I was in Las Vegas. I just got a new job getting into modeling. On my way to go see some friends, I was in a horrible car accident. A car had ventured over and hit me head on. I don't remember much about the accident. I just remember the impact and waking up in the hospital. When I was coming to, I knew something was really wrong because the doctors didn't want me looking in a mirror. From the impact, the windshield shredded the right side of my face in multiple areas. So I got near 100 stitches from the top of my right side of my face. I knew my dream to be a model and do the facial work I wanted to do. It was over and it broke my heart. Now having this scar, I constantly have to find ways to hide it and conceal it. I try to wear hats sometimes, but just constantly wearing styles that cover the right side of my face. My facial expression is completely different, like completely different. Not the same at all. I just became very insecure. I could have done so much more with my life had I felt more confident, could hold my head up a little higher. I think the surgeon's going to give me the life I felt I was meant to live.
Hi, Lisa. Hi. Okay, looking at your scars here, looks like you're missing some volume in general, right up in this area here. Normally when you do a scar revision, you cut out the old scar, but today we're trying something new. We're using a cosmetic technique called live fill, and we're actually placing live fill to replace the scarred tissue. So this operation was basically 3 parts. The first to debulk the area above her right eyelid where she had puffiness due to the accident. The second to restore the right eyebrow, the deeper tissues, with live fill. Then we moved to the next area, which was to the side of the right eye, where we revised the scar and placed live fill into the cheek. And last, and most difficult, we revised the scar that went down her face to the side of her mouth. We found a big piece of glass there and some scar tissue. So we removed those and we closed everything carefully. So now she's all done. She'll see a really nice result.
Plastic surgeon Dr. Brent Moelleken joins us, and before we bring Lisa out, I want you all to look at her picture before once again. Are you all ready to meet Lisa? Lisa, come join us. Lisa, I can sense not only that smile is legit from ear to ear, but emotionally this is big. How has this changed your life?
Oh my God, it's everything. My confidence level, I feel so much more empowered. Like I can wear different hairstyles, I can wear my hair out my face and people look at me and instead of asking so many questions.
I mean, just look at that before and after, and at first glance, wow, you wouldn't even necessarily know that you had a scar there.
Oh, thank you.
And
yeah,
Lisa,
I'm so grateful.
I mean, amazing work. Amazing, amazing
so grateful.
work.
So Dr. Moelleken, what makes this procedure unique? Because clearly the result's phenomenal.
Well, I mean, from a purely technical standpoint, what we did is we revised the scars, but whenever you have an accident like this, there's a tremendous loss of volume of the tissues below. So we have to figure out a way to restore the volume, and it's much harder than it may sound. So I've used a technique literally in thousands of patients for cosmetic purposes, for augmenting volume in the face. And, you know, Lisa Monique came in, and, you know, I have a charity, and, you know, she's a perfect candidate for it. So we use live fill to augment the volume, and we revise the scars at the same time.
So you literally took some fat from the area in her belly, which everyone has. Everyone has fat there, and transplanted it to her face.
Right, exactly, yeah. So what we're doing here is we've harvested the live fill, which is strips of her own tissue. So it's not processed, it's not aspirated, it's not centrifuged or anything like that. So I revise the scars and then place the live fill under the areas where there is tissue missing. That's the critical point. So it's not just a scar revision, it's placing the live fill underneath the areas where there's volume missing.
And for people watching at home, you know, the scar was bad enough and there was missing volume, but that's also dangerous territory because of the nerves involved. So your work was even harder, and you were even luckier.
Yes, I had a twitch before in my face, and so him having done what he did took the twitch away also, because that brought extra.
This is a success story all the way around.